Hi, everybody. Welcome to this week's episode of Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida. And I'm very excited to welcome back a former guest of ours, Dr. Shainna Ali. How are you doing today?
I'm doing well, Faith. Thanks so much for asking.
Of course. So before we get started, thank you all so much for attending this show via, virtual platform as always. This show was created with the intention of developing coping strategies and wellness tools during the era of COVID-19, but also to talk about mental health topics related to that. And to do that, we bring on people who work in the mental health field to talk about these topics. And so one thing that we're actually experiencing this week is the week for National Suicide Prevention. So that is actually our topic today. And I'm going to start by asking Dr. Shainna, are there any populations that are more at risk for suicide?
I think this is a great question, and it's a question that I get asked often in reference to suicide, but also to mental health illness concerns. And the disclaimer that I'll start with is if we look into statistics, we will find some information that says that maybe certain genders or ethnicities or individuals with socioeconomic status concerns may be at more risk. But I do want to give the disclaimer that it's important to recognize that mental health concerns, including suicide, do not discriminate. So I will delve into the risk factors a little bit more so that can help to empower you to see what you can do to be a strong advocate. But it's important to also recognize that, okay, this says that males are more at risk than females. So I identify as female or I don't identify as male. So therefore it doesn't affect me. Please be sure that we don't think about it that way. Now, with that being said, before we even jump into suicide risk factors, it's important to recognize that mental health concerns in general that are maybe untapped, unattended to, there's no access to services, so you can't get any help in that way, those can become more exacerbated, including becoming a suicidal risk. So it's important to first even look at what are factors for mental health problems in that way. So feelings of hopelessness, poor coping, such as through substance use or abuse, barriers to mental health care, isolation, which is one that I know that a lot of people are unfortunately experiencing now, loss of either someone or something in your life, such as your job, new diagnosis of physical illness, especially if it's severe. And those are all that can just cause mental health problems in general. But as it goes on over time, the more you endure that without being able to get help can absolutely become a suicide risk factor. Now, on top of that, there are specific risk factors to suicide that we should consider. Just sharing a little bit of a few here to help you would be family risk factor of suicide, so history, even the individual's history, so history of past attempts or past thoughts. Also cultural beliefs around suicide, especially if their beliefs kind of lauding that type of behavior. And also access to lethal methods. So again, there are risk factors for suicide in general, but also if we take a step back, it's important to recognize that there are risk factors for mental health illness. And if we are proactive about those, then we may be able to be really proactive about suicide prevention.
Thank you so much for elaborating on that a little bit. I do apologize for my dog jumping in there. I'm so sorry. We're recording during a pandemic. I guess it's just the reality of being at home. But thank you so much for, starting with that conversation. I think that when we talk about suicide prevention, we so often sit there and talk about, being aware of it, being aware of the signs of it. But I think you make an excellent point that a lot of times it's important to look at, before we get to that point. Let's look at, what can we do when it comes to identifying, any mental health struggles. And if there are some, like you said, we're in a pandemic. I think a lot of those can be exacerbated right now, or people are experiencing a hard time, that it's important to address those now and validate those feelings now. And hopefully, we can get to a point of not needing to be there with that that fear or that concern of at risk for suicide and help lower that risk. But at the same time, it does happen, and I appreciate you being here to be able to talk about that. So thank you for starters. I'm sorry for that slightly long-winded response.
No, thank you. And if I may jump in to just piggyback that you mentioned there. I think it's important to recognize that suicide, discussing this in general, just like discussing any other severe mental health problem, can be really intimidating. I understand that, so this is my field and it's intimidating for me. I understand that to the average person, it can seem really daunting. Can I do anything about it? Is there something I can actually do as the average person? And we're going to get to that a little bit more later, but I wanted to emphasize that, if we want to talk about suicide awareness, like we're delving into today, but prevention, the key really is mental wellness. And there's a lot of obstacles right now, whether it's the pandemic, access to care, I could go on, to mental wellness, but the key to suicide prevention is mental wellness. So it's important for us to think about that, because it helps us all to then think, okay, what can I do about my mental wellness that can help me prevent my own risk of suicide, but also then thinking about your loved ones, your community, and going from there.
Thank you so much. And that kind of leads me into my next question. The whole topic here today is openly discussing suicide in our community. And one thing that we as an agency have experienced is the community reaching out to us, kind of asking about how the pandemic has contributed to people's mental health and even suicide risk. And so because we're seeing right now in the time of COVID that challenges are heightened, like you said, feelings of stress, anxiety are heightened. What factors would you say of COVID have contributed to this increase in, mental health struggles or even that suicide risk factor?
Yeah, it's a great question. And it brings me back to our first discussion in coping together when we were just talking about coping in the pandemic in general, which we are still in, right? Months later, this is still a pandemic. So even recognizing that, right? Even our first conversation about just coping in general in the pandemic, the fact that it's been months and we're still coping. So something to think about is that everybody has had different walks of life in this pandemic, but we're all affected in some capacity. So it's important to think about how it affects you and how it may affect individuals in your life too. And of course, there are different risk factors that we're all experiencing in the pandemic that could, of course, exacerbate any other mental health concern. So common ones have, of course, been isolation. I think about, especially when there were lockdown orders in place, and even now, wherever we're at, you and I are in Florida, mask mandate, this feeling that we are disconnected from one another and having to be clever about how can you connect. How can you feel connected to someone else when you may live alone and you may be working from home now? So a lot of your life exists in your abode only, and you don't have connection to people anymore. So even thinking about isolation, which is absolutely a risk factor for both mental health and suicide risk in general. And then also thinking about stressors. So stress affects everyone differently. And depending on who you are in this pandemic, you may have new stressors that are affecting you. You may have exacerbated stressors that are affecting you. And most people are experiencing multiple stressors at the same time. And some people have been actively working on their coping pre-pandemic and may have that buffer of mental wellness that they can be building on. But even if people had that, if they were not focusing on it since this pandemic started, it's likely that would be wearing thin. Many of us have had to adapt to how we cope in this time. And that's really helpful to think about. Risk would be coping, so you can kind of create a barrier for that risk. And then the last thing that I'll emphasize is the difference between conditions that were existing before, which of course could be exacerbated by the increase of stress in the pandemic, but also that there are a lot of individuals who are experiencing a level of mental health concern that they may not have before. So individuals who have been experiencing it, if they were fortunate enough to have access to care, there may be some tidbits about their wellness journey that they're able to utilize in the pandemic that helps to serve them well. But then there's also individuals who may not know a lot about coping skills, about their own warning signs, about creating a support system. And it's important to recognize that a lot of people are in that boat. But in terms of actually having statistics, my understanding is we don't have the stats yet to say whether or not it's any worse in the pandemic. However, there's not one colleague that I've talked to about stress in this pandemic, mental health in this pandemic, that has said that it's not been affected. So my presumption is that many people are having a mental health effect. And the worst mental health effect, of course, is a serious problem such as suicide.
Thank you for elaborating on that. And to kind of add to that, I mean, even in just my own personal experience, I work in the mental health field. So plenty often I talk to people who already have, already been struggling with things. But I talked to someone not so long ago, and one thing they said to me is, this is so unnew territory for me. They are, worried about their children who, especially class of 2020, or kids who are in high school that didn't get to go to prom. I remember they said, I don't know what to do. I don't know how to know if my child is okay. And I think that there's an importance that you said in that, and just acknowledging that this is new to a lot of people, and it doesn't take away from the validity of people who have experienced mental health struggles previously. It's a different experience. And so it is important to acknowledge that. And also, that, again, I'll say the validity or empathy of someone who is going through something hard. It's okay that it's happening. It's happening to a lot of people, but it doesn't mean any less if it's your first time struggling with it or if it's your 20th time struggling with it. Because like you said, we're all in, what right now is a pandemic, but we're always going to be in different struggles in our lives.
Exactly.
Perfect. Okay. So it seems like this is a really prevalent issue. I mean, we're in Suicide Prevention Week. Why don't people talk about it as much?
Yeah, it absolutely is a prevalent issue, and it's a prevalent issue globally as well. So it's interesting to think about why we don't talk about it. And I think if I were to give you a succinct answer on that, it would be stigma, which exists, as we know, in terms of mental health at large, but especially when we're talking about suicide. I think there's a lot of misinformation, there's a lot of biases, and a ton of stereotypes around mental health, mental illness specifically, and around suicide, that then it just doesn't get talked about. And across lots of world cultures, it's the easier thing to hush hush, push it under the rug. But that's also one of the biggest risk factors, is not addressing something proactively. You can see how this just kind of perpetuates that cycle in and of itself. So I like to think about, okay, if stigma is a problem, and maybe we've gotten a little bit better, but there's definitely work that we can do. I like to empower folks to think about, what can you do about this stigma? So even everyone just listening to this, thinking about, what are the beliefs that you hold about mental health, mental illness, and specifically suicide? Where are some gaps that maybe you would like to fill, that you can look into more information on, to better inform yourself and to be more safe for yourself and for your community as well? And also being willing to have some courageous conversations. I always think it's better to ask and talk about these things proactively. Then you can even I think we were talking about warning signs and risk signs before, that brave discussion can really be truly impactful. So even knowing how that is, but a lot of times individuals are super intimidated by stigma, not wanting to offend someone else. And to be fair, these discussions about suicide are really difficult to have. And I also want to normalize that not everybody is trained and taught how to have those conversations. So it's also important to recognize when you are bearing a heavy burden, either by yourself or even if you recognize that someone's at risk. And instead of letting stigma hold you back, recognize, okay, maybe I can help myself or this person get help from a professional as well.
I appreciate you touching on that, especially because I do think it's something we've talked before about, on coping together, and it's consistent, is what can we do? Because I think, especially right now in the pandemic, whether it's, a loved one is struggling with their own personal loss, whether it's a loss of a loved one, loss of a job, or you have, a first responder who's, experiencing these struggles on a daily basis. A lot of us ask, what can we do? And I think an important thing that you've said is just that information is kind of power in a lot of ways. It can help you better understand, but it's also okay to acknowledge that you don't know what's going on. You don't know what to do, but you love the person that you're worried about, or you love, you want to figure it out for yourself. And that, I think, is where there's a lot of different resources that exist. And so I want to ask you, do you have any, I know there are so many, but can you think off the top of your head, even just a few that you would recommend to our viewers to look into, whether they're wanting to increase their own knowledge or help somebody else?
Yes, I absolutely do. And I think that even for anyone listening in, even if you're listening to this and you're watching and tuning in, trying to educate yourself, I want you to give self credit, because that is a great starting point. It's knowing whatever the the gap is for you, because it might be different from one person to another, and informing yourself. One area that many people have the gap is, what do I do next? Where are the resources, right? And I think that the one that I probably use the most is referencing the National Suicide Prevention Lifeline. And it is a number, but also over the years, they've included a text line and a chat option online as well. So there's different aspects there for whatever you're comfortable with. I think that's a great resource because it can occur no matter where you are listening to this. This could be an option for you. But I also think it's helpful to empower yourself about finding what your local resources are. Again, whether it's for yourself or for someone else. So where's your local mental health association, right? So if you don't know, maybe they can help you fill in the gaps. Local providers, access to care, low or no cost care as well, because if we're thinking about prevention, it's also getting access to mental health counseling as well.
Thank you so much. And actually, to kind of add into that, referencing our own agency, the Mental Health Association, if you're not located in Florida and you don't know where to start, Mental Health America has chapters all over the country. And we'll get people calling us from all over places, even if we don't know exactly what is in your local area. The internet is a powerful thing, and we will do what we can to work with you and try to find some options that are near you. That being said, like Dr. Shainna, Dr. Ali said, is that there are a lot of national resources as well. There's the National Suicide Prevention Lifeline. The American Foundation for Suicide Prevention has a lot of different resources, things like that. And then for us here in Florida, you have the Mental Health Association of Central Florida, we have NAMI, we have 211, and these are all things that we don't expect you, us working, we don't expect you to know exactly what they are and the ins and outs of them. I mean, that's why agencies like ours exist. So you can ask us these questions, and so we can help you find the answers to that. But I think the biggest thing, and I really appreciate you saying this, Dr. Ali, is that it's just about, wanting to build the information for yourself or for those around you. And there are so many options that exist. So thank you for touching on that.
Yeah, absolutely. And the last thing I would add on top of that in terms of empowering folks for what can they do, I've already talked about, I understand that it's daunting. It can be intimidating. You might think, this is not my field. I don't know what to do. And that's okay. So the steps are to make sure you inform yourself, expanding your knowledge, learning resources as a part of that, as we just talked about, but also advocate in the way that works for you, right? So if you have a big social media platform, I don't think you should underestimate how posting about any of the resources that Faith just mentioned could help someone, right? If you have a friend that you're recognizing warning signs and you want to help intervene and you contact the Mental Health Association to say, how can I better help this person? That's you being an advocate, right? And I know that there's a lot of wonderful ways that we typically advocate for mental health and suicide awareness that we may feel like we are inhibited right now because of COVID. Volunteering might look different, attending events may look different, but you can still do what you can still do. So fundraising still happens. The election is still happening. So thinking about, putting your vote where it also supports mental health. So there's lots of different ways that you can advocate. So, sometimes it gets intimidating and you think, well, I can't do that. And sure, you might not, but does it mean you can't do anything? So I think that if we all work together and we all play our part, no matter how little it may seem to you, it's definitely more work than we've had in the past. And when we're working together, that means more community and mental wellness, which means more suicide prevention.
That was, I think, a really perfect way to kind of tie everything together. And so with that being said, you've answered all my questions for today. Was there anything else that you wanted to let our audience know before I let you go?
No, that's all, but thank you so much. And I hope that everyone leaves here kind of critically thinking about where they are in their journey and how they can actually be an advocate, not just for mental health, but also for suicide prevention.
Thank you so much. And for those of you watching, thank you as always for tuning into Coping Together. You are the reason that we're able to do this show. As we talked about with a bunch of these different resources, we're going to include a lot of them in the description for this video. But if you have any questions about anything, please feel free to reach out to us at the Mental Health Association of Central Florida. And we can try to get you, paired up with different mental health resources, whether it's someone as wonderful as Dr. Shainna, or different things in your area like support groups, group therapy, psychiatry services, whatever it is. We want to help you, and we want you to know that you're not alone. So thank you so much, Dr. Shainna. Thank you so much to all of you, and you have a great day.
Thank you so much.